Welcome to the fall edition of Sepsis Chatter. Since the Sepsis Alliance Organization has designated each September as Sepsis Awareness Month, this presentation will focus on sepsis awareness and spreading the word. Who is the Sepsis Alliance and what is it that they do? According to their mission statement, the Sepsis Alliance is the leading sepsis organization in the United States working to save lives and reduce suffering from sepsis. The Sepsis Alliance is providing healthcare professionals, the general public, those impacted by sepsis, and lawmakers with the education, support, and advocacy to help save lives and limbs from sepsis. Why was the Sepsis Alliance formed in the first place? The Sepsis Alliance was established in 2007 in response to the death of Dr. Carl Flatley's daughter, Erin Flatley, who died from sepsis. Since its inception, the organization has grown to include the Sepsis Alliance Institute, which focuses on education, networks, resources for clinicians. Also, the Sepsis Alliance Voices, which focuses on advocacy related to policies and laws in the United States. In addition, the Sepsis Alliance Connect, which provides support for those affected by sepsis. And finally, the Sepsis Innovation Collaborative. This is a coalition that includes academics, clinical advocacy, reimbursement, and research related to sepsis. In 2011, the Sepsis Alliance declared the month of September to be Sepsis Awareness Month. Since then, the Sepsis Alliance has been working diligently to advocate and educate for various populations about all things sepsis. They have developed campaigns and projects such as Sepsis, It's About Time, that focuses on how to recognize the signs and symptoms of sepsis and the importance of immediate treatment. And Superbugs, it's an awareness campaign that stresses the relationship between antimicrobial resistance and sepsis. Erin's campaign for kids, training and resources for health professionals to identify and treat sepsis in children. And finally, they have developed a yearly sepsis awareness survey, the annual surveys to measure how many people in the United States could define sepsis. There's been a slight improvement from 2010 to 2022, which we'll discuss later. Why designate an entire month for sepsis awareness? There are 5 good reasons that come to mind. Sepsis is a medical emergency. The costs are astronomical. It doesn't discriminate and can affect anyone. Also, sepsis can lead to life-altering post-sepsis syndrome. Although the first 4 reasons seem very ominous, the most important one is that sepsis is treatable and that it is reassuring news. Let's take a closer look at the human and financial burden that sepsis causes. First, let's take a look at this human aspect, statistics related to the incidence of sepsis in the United States. According to the Society of Critical Care Medicine, sepsis is the 3rd leading cause of death in the United States. It accounts for more than 50% of hospital deaths, and 1 in 3 people who expire in the hospital have had sepsis at some point during their hospitalization. According to the 2024 CDC Quick Facts, 1.7 million American adults develop sepsis. Of those, 350,000 adults either die or are discharged to hospice. Most sepsis cases begin outside the hospital and present to the ED. A majority of sepsis patients have at least one underlying medical condition or are immunocompromised. Up to 1/3 of the patients admitted to the hospital for sepsis had seen a healthcare provider within the week prior to admission. And it doesn't stop there. There's also the financial impact. According to the Society of Critical Care Medicine, it costs roughly $62 billion a year for sepsis treatment. This estimate includes no outpatient costs. It doesn't include office visits, durable medical equipment, medication costs, no health care costs, skilled nursing visits, physical therapy, aides, or custodial care in a nursing home. That estimate further does not account for the secondary costs, such as loss of employment, loss of productivity by the patient or the family members taking care of them, and many others. So the 62 billion estimate should really be adjusted up to reflect the above mentioned unaccounted for costs. As mentioned earlier, sepsis can affect anyone. This includes otherwise healthy people, infants and elderly patients, patients with weakened immune systems, and patients who have chronic medical conditions. Examples of otherwise healthy people at risk for sepsis could be a young woman with an untreated UTI, or it could be a 30-year-old man with multiple injuries from a motor vehicle accident. He has a fractured femur with exposed bone. He would be at very high risk for sepsis. Neonatal patients are at risk for sepsis. Examples are a premature infant due to the immature immune system. It's just inherently a risk factor. Also, an increased risk for sepsis is associated with an APGAR score of less than 7 in the 5th minute of life. Put that one in your pocket. So elderly patients also are at high risk for sepsis due to overall frailty and compromised immune systems. Many of them live in group settings such as skilled nursing facilities, assisted living facilities, where illnesses are easily transmitted between residents. They're more likely to have comorbidities, which increase the risk of sepsis. Patients with weakened immune systems, such as those with HIV, cancer, autoimmune disease, are in a high risk category. Patients with chronic conditions such as diabetes, COPD, renal disease, history of stroke, they're also at very high risk. And lastly, hospitalized patients. They're worn down, they're compromised, they're usually immobile. The environment puts them at risk of cross-contamination. And treatments and devices increase the risk of infection, such as IVs, urinary catheters, central lines, endotracheal tubes. You get the idea. Post-sepsis syndrome is a condition that affects up to 50% of sepsis survivors. It includes physical and/or psychological long-term effects, such as repeat infections requiring multiple hospitalizations, amputations due to hyperperfusion and necrosis, lung damage with difficulty breathing, kidney damage that requires ongoing dialysis, peripheral neuropathy. Also, psychologically speaking, memory loss, insomnia, depression, panic attacks, hair loss are a few of the issues that post-sepsis syndrome may trigger. Also, patients who were treated in the ICU, as well as those who have spent a long period of time in the hospital, are at increased risk for post-sepsis syndrome. 60% of hospitalizations for severe sepsis were associated with worsened cognitive and physical functioning among surviving older adults. Children, 34% of survivors, are still experiencing deficits 18 months after recovery. Also, post-sepsis syndrome has a PTSD component to it. It's associated with the ICU stays due to severe sepsis and septic shock. Re-experiencing the trauma through flashbacks and nightmares feeling emotionally numb, avoiding places, people, and activities that are reminders of the trauma, difficulty sleeping, lack of concentration, and feeling jumpy are a few of the symptoms that a person with PTSD may feel. So post-sepsis syndrome can be debilitating indefinitely. Patients need and deserve all of the support for as long as needed. The final argument in the support of an entire month dedicated to sepsis awareness is the fact that sepsis is treatable. It's possible to minimize the effects of sepsis through early recognition and treatment. There's an infinite number of scenarios and opportunities to identify a person who may be septic. Non-medical populations should be educated about the signs and symptoms of sepsis to prompt them to seek treatment early. It is important to stress that a wait and see if I feel better strategy can affect the severity of the illness and land the person in the hospital. Healthcare professionals in all settings should be well versed in identifying patients at increased risk for sepsis, recognizing the signs and symptoms of sepsis, know what the severe sepsis, septic shock 0 to 3, and 3 to 6 interventions are, and initiate treatment if the setting allows. Refer symptomatic patients to a higher level of care quickly and provide a sepsis-focused report to the receiving facility. As healthcare providers, we are aware of the burden that sepsis, severe sepsis, and septic shock present to individuals, healthcare providers, facilities, and healthcare costs. So how do we spread the word about sepsis awareness this month and all year long? First, there's really no need to reinvent the wheel. A number of the sepsis-focused websites have great toolkits and information that is free that you can download and you can use for educational purposes. So, for example, the Sepsis Alliance has created a one-stop shop, and they have a really nice toolkit for Sepsis Awareness Month, and it's free. The CDC has Get Ahead of Sepsis Partner Toolkit, and this is also free. End Sepsis, the Legacy of Rory Staunton website. They have fact sheets, infographics, advocacy activities. You might want to stop by there and take a look at what they have as well. And of course, World Sepsis Day Organization website, they also have a toolkit that may be useful for you as well. So that's just something to think about. What can we do to spread sepsis awareness in the healthcare setting? Create a sepsis-focused newsletter for staff. Play a sepsis-themed game with the staff. Host an online or in-person sepsis coffee break. Provide sepsis pocket buddies to staff. Share upcoming Sepsis Alliance posts in the month of September on social media with hashtags Sepsis Awareness Month and SAM 2024. A few final thoughts, and then we will conclude this presentation. Anyone can develop sepsis, severe sepsis, and or septic shock. While there are specific populations who are at higher risk for developing these conditions, anyone with an infection can be affected. Sepsis, severe sepsis, and septic shock should be treated as medical emergencies. According to the CDC, these are time-dependent conditions that require timely management in order to reduce mortality. The cost related to sepsis has proven to be minimized by early detection and treatment. Again, early recognition and treatment is key to reducing the overall physical and financial costs that sepsis creates. So, how can we spread the word? How do we encourage early recognition and treatment? Start a sepsis conversation with family, friends, and coworkers. Take any opportunity to educate the general population. It should be known that 66% of adults do recognize the word sepsis. However, only 19% can name the main 4 signs and symptoms. Let's change this. Continue to educate and support providers and staff who are in the perfect position to identify and treat sepsis on the front lines of healthcare. Take advantage of the Sepsis Alliance Awareness Month toolkit, along with the other toolkits that I had mentioned earlier. And please see the list of references included on the following slides. This concludes this presentation. As a reminder, I encourage you to refer to the following slides for helpful reference material. Thank you for attending today, and please spread the word this September.